And welcome back to This and That as we are live from the Ronald McDonald House as we are celebrating 40 years strong all across the world. Ronald McDonald House has been helping 9 million families since the beginning, and we're helping thousands of families even right here in Chattanooga. Joining us right now, we have Dr. Alan Kort, who's the CEO of Children's Hospital, along with Jane Kaylor here, who's Executive Director of the Ronald McDonald House. And Dr. I want to talk with you first because oftentimes when we think about the Erlanger's Children's Hospital, we think about, well, we need to go to Atlanta, we need to go to Vanderbilt, but what you guys have available here is top-notch as well and helping thousands across the region. Talk a little about, in general, the Children's Hospital and what's so unique about it.
Well, actually, the Children's Hospital has, been here since 1928.
Wow.
When T.C. Thompson founded the original hospital. And in 1975, they moved up here to the current location. And it has served, as you said, literally thousands of kids every year. We have over 39,000 visits to the emergency room every year, and over 5,500 kids admitted throughout the year. And we have a neonatal ICU, we have a pediatric ICU, and we also have the floor where we take care of the kids who are not as sick. But I think the really unique thing for Chattanooga is the whole fact that Chattanooga is not a big city. And yet we're able to have a children's hospital that has almost every specialist and pediatric subspecialist that is needed to provide the care. So because of Jane and because of what Ronald McDonald House has, people can come from all over the region, get the care they need, and still be able to stay in the area and be close to their children while they're here.
And Jane, he kind of touched on the fact that we're not a very big city. I mean, Chattanooga holds its own, but when you think about big cities, and even Ronald McDonald Houses in these big cities, they have all three aspects. But a city maybe our size doesn't have the mobile care unit, or doesn't have the house, or the family room, all three together. Here we do. Talk a bit about some of the other things that we have, like the mobile unit and the family room.
And the only way we can do it and be a part of this huge system is we have a wonderful global system. We have the unbelievable support of this community. We opened the world's 4th family room inside a children's hospital, and we got the 13th care mobile in the system. So we've been part of every new program that's come out for our global organization. We've been able to do that because we have great partnerships with Children's Hospital. I believe we're a great part of the family-centered care that's so important to families when they have a sick child. As Dr. Kohrt said, allowing them to stay here close and get the care that they need, that their child needs. And also our partnership in that they gave us space inside the hospital to do our Ronald McDonald Family Room, which provides respite for those who are staying with their child in a patient room and getting all those kinds of services. And then we're partners with our Ronald McDonald Care Mobile. We are kind of the glue that keeps all these groups together. It's a huge collaboration working up in Bradley and Polk County to provide health care right in the school-based health care right at the school where the children are sick and helping them to stay in school. But that's only because we have this partnership.
Now, when it comes to a sick child, sometimes there's families that are out there thinking, who is it that really needs the Ronald McDonald House, or the AIDS group, but who is the target audience?
Well, a pediatric patient is defined at age 0 to 21, and so that's our guidelines. The only other guideline we have is that the child be critically ill and the family live at least 15 miles away from the hospital. That's all, and it takes a referral from a medical caregiver, and that's who stays here at the house. Anyone who has a loved one in Children's, Erlanger, or Siskin can use our family room, and then our care mobile is providing services to the children in Bradley and Polk County.
And obviously it takes a lot when it comes to volunteers to help out as well. We're going to come back here in a couple minutes from the kitchen and talk about how folks can help out volunteering and giving to the pantry as well. But coming up after the break, though, we're going to talk with a local family because it's sort of best to hear from the family that's impacted by the Ronald McDonald House and how it can literally save their lives as well. We'll be right back.